Hello, my name is Patrick Ifesinachi Emelife. I am a regional anesthesiology and acute pain medicine fellow at Stanford University School of Medicine. During this presentation, I'll discuss the sciatic nerve blocks from the subgluteal and popliteal approaches. The sciatic nerve is the largest nerve in the body. It is comprised from L4 to S3 roots. It descends between the greater trochanter laterally and the ischial tuberosity medially. As the nerve descends into the popliteal fossa, it divides into the common peroneal and tibial nerves. These images show the dermatomal distribution of the sciatic nerve block from the subgluteal approach. Of note, the posterior thigh is not covered by this block, as this area is innervated by the posterior femoral cutaneous nerve. Also note, the medial aspect of the lower leg is also spared. This is covered by the saphenous nerve. Compared to the transgluteal approach to the sciatic nerve block, the nerve is more superficial when approached below the gluteal crease. This block is excellent for coverage in the posterolateral knee and the entire lower leg except the medial aspect, which is covered by the saphenous nerve. This block is also great for above-the-knee amputations when used in combination with a femoral block. As mentioned before, the posterior thigh is spared when using this technique. If you'd like to get coverage of the posterior thigh, the transgluteal approach to the sciatic nerve would be appropriate. Here, you can see the sciatic nerve is sandwiched between two muscles. The gluteus maximus is superficial to the sciatic nerve, while the quadratus femoris muscle is deep to the sciatic nerve. Lateral to the sciatic nerve is the femur, and medial to the sciatic nerve is the ischium. This is the same image as the previous slide, but without the labels. Notice that the sciatic nerve is triangular in shape at this level. As the sciatic nerve travels distally down the thigh, it becomes more oval in shape. When performing the subgluteal sciatic nerve block, it is appropriate to have the patient positioned in the lateral decubitus position. The ipsilateral hip and knee should be flexed so that the sciatic nerve will be as superficial as possible. The transducer should be placed on the gluteal crease transversely, or just below the gluteal crease. The needle should be advanced in plane using a lateral to medial direction. 10 to 20 milliliters of local anesthetic is appropriate for this block. We will now turn our attention to the sciatic nerve block approached from the popliteal fossa. The popliteal sciatic nerve block is used for analgesia to the lower leg except the medial aspect of the lower leg, which is supplied by the saphenous nerve. This block is great for foot and ankle surgery. Here is the cross-sectional anatomy of the sciatic nerve and the popliteal fossa. Notice that the sciatic nerve is superficial and lateral to the popliteal artery and vein. The sciatic nerve splits into the common peroneal nerve and the tibial nerve. Here is the sonoanatomy of the popliteal fossa. Again, notice that the sciatic nerve is superficial and lateral to the popliteal artery. It is also sandwiched between three muscles, laterally by the biceps femoris muscle, and medially by the semitendinosus and semimembranosus muscles. The sciatic nerve divides into the common peroneal and the tibial nerves between 4 and 10 centimeters above the popliteal crease. Here is the sono anatomy of the popliteal fossa at the point where the sciatic nerve branches into the common peroneal nerve and the tibial nerve. 3 different positions can be used to perform the popliteal sciatic nerve block. The patient may be supine, lateral, or prone. The needle is advanced in plane from lateral to medial. 10 to 20 milliliters of local anesthetic is used for this block. If you're having difficulty visualizing each nerve, you can ask the patient to plantar flex or dorsiflex. When the patient plantar flexes, the tibial nerve is elevated towards the transducer. When the patient dorsiflexes, the common peroneal nerve is elevated towards the transducer. I would like to wrap up this presentation by asking one question. The cutaneous sensation of the medial leg, distal to the knee, is innervated by which nerve? The answer is the saphenous nerve. The saphenous nerve is a terminal branch of the femoral nerve. The saphenous nerve provides sensory innervation to the medial aspect of the lower leg. This concludes my presentation of the sciatic nerve block from the subgluteal approach and the popliteal fossa approach. Thank you.